And we're back. I'm Twanda Black, your host. It's People for People. And joining me today, Dr. Michael Obiekwe. He is the founder of Arms of Care International. And before we went on the break, we were talking about how people find out before you go to whatever rural area you're into Africa, because you know you can't email in. Nobody has computers or anything. So you were telling us about how people find out about when you come and what you're going to provide.
Like I said, that we have a local host that we usually make sure that he's capable of providing a few things that we require. And one of the things we require them is to announce to the local populace that we are coming, and to announce specifically the services we're going to provide. If there are theater suites in the place that can handle minor or similar surgeries, then we would provide surgical care. Okay. We must have made contact with the facility and make sure that they have the basic things that we need. Mm-hmm. Now, if they don't have a theater facility, we just go ahead and see the people, treat them for the diseases that they have. Mm-hmm. One of the things we've done is to find the nearest hospital, transfer people to those hospitals who are in dire need for surgery, and then sometimes pay for their surgical operations. Oh, okay. We've had to do that where we had to transfer someone to an ophthalmologist, mm-hmm. and they did some cataract surgery. That was about 2 hours away from the closest hospital where they could do that. But most of the times we try to do most of those things alone. In other words, by the group, mm-hmm. Arms of Care, mm-hmm. while we are in those areas. And we try not to do heroic things. We don't have to do goiter surgeries, right. Because you start talking about general anesthesia. No, most of the things we do are things either we can do under regional mm-hmm. anesthesia, mm-hmm. using spinal anesthesia like epidural, right, where you can block mm-hmm. the spine mm-hmm. and the patient is paralyzed, from the umbilicus downwards. And therefore you can do any kind of surgeries, or like lumps and bumps, you can take that local, under local mm-hmm. anesthesia. Mm-hmm. So that's kind of things we do. And then if we have to provide medical treatment, of course we examine the patient, establish a diagnosis, and treat accordingly. Also bear in mind that we'll try to get the local doctors to right. partner with us, mm-hmm, mm-hmm. those who want to volunteer their time. We did a lot of that in Jos. We had a lot of local doctors. We're about 15 total. Up to 10 local doctors mm-hmm. partners with us. So we're able to see more people. But most times you're in a place where you don't have any local doctor around, and it becomes a problem, for you to do that.
Now tell us about Arms of Care International and how we can help you do what you do best.
Well, we want people to partner with us. We want people to help us in logistics. Most times we have to do these things ourselves, mm-hmm. just a few of us. Pat Stroman has been very, very instrumental. I have also been going with my wife most of the time. She's a registered nurse. Her name is Elizabeth Obiekwe. Mm-hmm. She's a registered nurse, so she goes with me most of the time. Mm-hmm. And then she also, helps us with medications and sometimes triaging the patient. But Pat Stroman has been very, very instrumental in helping us with the logistics when we're here. She's an extraordinary lady. But we need more hands, people to help us in raising funds, because our ultimate goal is not just to go and come back. Establish a rural clinic, mm-hmm. Mm-hmm. not in the big cities. We're talking about areas where people don't have, the access.
Yeah, where they got to travel 5 hours exactly. to get to the city,
Establish a rural clinic, train 4 or 5 auxiliaries. We'll call them, in low level. Mm-hmm. But most things that usually kill in those areas are things that can be prevented. Malaria, typhoid, mm-hmm. These are things that can be taken care of. They need a little bit of education. And so mid-level people can provide these services, immunizations, mm-hmm. Train them with the skills, supply medications as we can, as much as the Lord grants us the strength, supply them with medications. I want to say at this juncture that, again, we go there with the fear of the Lord, and we want to share our beliefs. Mm-hmm. When we go there, we share the Word of God and encourage people. These are people who are hopeless. We're talking about people who don't have anything. Yeah. Sometimes it's so pathetic. The last trip I went, I felt like I don't want to come back. Wow. But however, somebody's going to be paying the bills. I need to come back and get the money. We host functions, and people can go to our website, again, www.armsofcare.com, and make donations. We are a 501k organization. People can make donations through the web to help us in establish these things. In Burundi, last year, we went to Burundi in Central Africa. It was pathetic. It wasn't a hospital. So a lot of HIV patients that we had to help to see. And one of the needs in the place is to go into the rural areas, because those with HIV, they are so much held down by the stigma. So my goal is to train some of these auxiliaries, go to the rural areas, help them with medications, encourage them with education on HIV. That with the medications we have now that most times are available in the rural, most of African countries, because of most funding organizations, they can live a normal life.
Michael Obiekwe is the founder of Arms of Care International. Thank you so much for joining us. This is People for People. I'm Twanda Black.